So according, if we talk about the health group, the health group, it is according to the dispensary observations guidelines in Russia or the Ukraine. It is based on, it is according to the dispensary observation guidelines in Russia or Ukraine. So it is based on the dispensary observation guidelines Russia or the Ukraine. So they classified the health group into the three main groups: group 1, group 2 and group 3. Group 1, group 2 and group 3. Now if we talk about the group 1, the group 1, it means if any individual without any chronic disease, any individuals without, this is without any chronic disease, without any chronic disease or abnormality, so that is the group 1. Group 2 means that some chronic disease are there, some chronic disease are there or abnormality are there. But we will see if in the group T some chronic disease or any abnormality will be there. Abnormality, this is not absent, this is abnormality, but you will see that their ability is working is not significantly affecting, but working ability not significantly affected, working ability not significantly affected. Then in group 3, what we will see, in group 3 we will see individual with severe chronic disease or abnormality, with chronic disease or abnormality. Here you will see the chronic disease or abnormality are there, along with that working ability will be significantly affected. And in this condition what we will see, there will be three conditions: 3A, 3B and 3C. 3A, 3B and 3C will be there. So in case of the 3A, this is the minor health problem. There will be the minor health problem will be there. Means not so much affected. Like for example, it can be the asthma, it can be the like any occasional mild disease, pneumoconiosis, all these conditions will be under the 3A. If we talk about the 3B, if we talk about the 3B conditions, in the 3B there is a moderate health problems. There will be the moderate health problem will be there. The moderate health problem will be there and moderately affect the work or as well as the other conditions. So it includes like the diabetic mellitus or the hypertension. In these conditions, working ability will be affected little bit. Then third C means this is the severe health problem. This is the severe health problem. You see, in case of the severe conditions, what you will see like the cancer, or there is can be the heart failure. So all these comes under the severe health groups. All this comes under the severe health groups. Okay, so this is what the health group according to the dispensary observations guidelines in Russia, Ukraine. Individual without any chronic disease or the abnormality, group 1. Group 2, the some chronic disease or abnormality but working ability significantly affected. Group 3 means individual with the severe chronic disease or abnormality, third A, third B, third C. Minor health problem like asthma, diabetes mellitus, hypertension or the cancer, heart failure. This is what you need to remember. If anything updated, I will tell you. There can be the conflict in some questions. So don't ask me, Bhaiya, this answer is this answer is this. Whatever the answer, mug it up. Okay? Whatever the answer is given in the test center website, mug it up. A child with a diagnosis, so we have seen chronic tonsillitis, 10 dispensarizations controlled. within the 1 year of observation there is one exacerbation of the disease. So we are seeing that the individual with the severe chronic disease physical condition is satisfactory, the general state is not infringed. So define the group of health. Okay, in this condition we have seen that the physical condition is satisfactory, but along with that we have seen that there is a individual is there but severe chronic disease. So it including the third, the individual, because there is a severe chronic disease and there is also the exacerbation of the disease, but there is a third A, there is a minor health problem, means this health will be, स्क्रीन बंद हो गई, वाईफाई तो मेरा ही चल रहा है. मम्मी पापा को फोन देना, फोन देना पापा का, हॉटस्पॉट ऑन कर दो उसका. It's now okay. Okay, so I was telling you this question, that in this question what you are seeing that there is a chronic tonsillitis. So we are seeing that the chronic tonsillitis is there, and the chronic tonsillitis means that this condition is what, that is the chronic severe condition. This is the chronic severe conditions. The chronic severe condition is there, so we will put it under the group 3. But along with that we see the physical condition is satisfactory, so this is the minor, undergo under the minor health group. So that's why it will be the third A group. Okay, is that clear? Now let's come back to the question number 13. This is again related to the hygiene question. Anesthesiologist give the narcosis to the patients. So what we are seeing is the anesthesiologist, but along with that we are seeing the narcosis to the patient. He uses a known anesthesia is a halothane. What we have with anesthesia is a halothane. The air temperature is in the operation room is 21. Now see, whenever the given the halothane, the halothane is anesthetic agent. It is the anesthetic agents. And also remember this halothane, they affect the air pollution. They have the problems with the breathing problems. They have affect the our cardiac systems also. That's why we say that it causes the air pollutions. We have the air pollutions. To prevent this, we use what? Activated charcoal. So this activated charcoals will absorb this halothane, so that's why the air pollutions can be prevented. So this halothane cause the breathing problem, the cardiac problems, and all it comes under the air pollutions. It's spread in the air, spread in the operating rooms, and then it cause these kinds of the problems. And along with that, to prevent these conditions, what we use the activated charcoals. So this is the direct questions. Halothane, air pollution with anesthetics. Now I think it's okay everything. ठीक है. Then the next question, a patient suddenly felt an acute chest pain radiating to the left arm. So what we have seen, there is an acute chest pain that is radiating to the left arm. Okay, the patient is excited. Whenever you reading the questions, it should be keep in your mind. Okay, acute, there will be the acute chest pain that radiating to the left arms. Okay, this arms, what arms is there? It should be keeps rolling in your mind. The patient is excited with a pale skin. Breathing rate is 38 per minute. AP is 180. Later, the patient lost consciousness and fell down. Pulse on the great vessels are absent. The pupils are equally dilated. Now we see that this patient, they have the acute chest pain. Acute chest pain, maybe it can be the case of the MI also, but or other cardiac problems can be there. And the patient is excited with a pale skin. Breathing rate we see 38 per minute. AP, the blood pressure is also high. Later, the patient lost consciousness and fell down. Pulse on the great vessels was absent, means he dead. क्या होता है जब वो मूवी के अंदर चेक करते हैं ना कि पल्स है कि नहीं है, अगर पल्स नहीं है तो मतलब बंदा गया. But if pulse on the great vessels is absent, still we can revive that children. We will go to the PUBG and PUBG what we will say, revive me please. तो वो क्या करेगा, revive, we can revive these patients. This death is not permanent death. We have the time 1 to 2 minutes. In that times, if we can revive that persons, that will be the great. If we can't revive, it will convert into the biological death. The pupils were equally dilated. So what is the most likely diagnosis? So we call this condition as the clinical death. We call this condition as the clinical death. So whenever we see that there is a two conditions, one we having the clinical death and another we having called the biological death. Okay. In Hindu mythology, what we see, जिसको जो भी है उनको पता होगा कि जब हम दाह संस्कार करने जाते हैं ना किसी का भी, तो इन द इनिशियल टाइम तो वो सर पे ना एकदम से एक हथौड़ा मारते थे. ठीक है, सर पे जब हथौड़ा लगता था तो वो हथौड़ा क्यों मारा जाता था, वो इसीलिए मारा जाता था कि बंदा अगर क्लिनिकल डेथ के अंदर है. तो बायोलॉजिकल डेथ मतलब होती है कि ब्रेन की डेथ. बायोलॉजिकल डेथ इज इक्वल्स टू वन वी हैविंग द, एक होता है क्लिनिकल डेथ और एक होता है बायोलॉजिकल डेथ. बट जो बायोलॉजिकल डेथ होता है ना, उसमें होता है कि अगर ब्रेन की डेथ हो जाती है तो मतलब बंदा कंप्लीटली डेथ है, वो इरिवर्सिबल कंडीशन है. सो इन दैट थिंग्स वी पुट द हथौड़ा की कुछ भी मतलब किसी भी चीज से, ताकि ब्रेन डैमेज हो जाए. तो ब्रेन अगर डैमेज हो गया तो बंदा कंप्लीटली एक्सपायर हो गया, डेथ कर गया. बट दैट वी कॉल द बायोलॉजिकल डेथ. ठीक है, इट्स नॉट रिलेटेड टू एनीथिंग. इफ यू दैट यू शुड बी हैविंग, दैट्स व्हाई आई एम टेलिंग यू इन द हिंदी. ठीक है, द क्लिनिकल डेथ, the difference between the clinical death and there is a biological death. The clinical death, remember, the clinical death, what we will see, the person's, the heartbeat or the breathing will stop. The heartbeat and the breathing will be stopped. This person is near to the death. This person will be near to the death. Clinical death is near to death. Near to the death. The persons can be near to the death. We will having the 1 to 2 minutes, and in that, in the first few minutes of the clinical death, अगर हमने क्या दे दिया, if we gave the CPR, or we can then in that conditions we can revive that persons. But once if we not able to give the CPR, so it will convert into the biological death. And biological death is the permanent brain death. It is the permanent brain death. Okay, and there will be the lack of oxygen. Once the lack of oxygen will to the brain, it means it is completely brain death. So this is the difference between the clinical death and the biological death. Next question, also the simple English. A 37-year-old patient come to the clinic. Clinic में आया being wounded in the area of umbilicus an hour ago. So he got the wounded. ठीक है, घायल है किसमें? In the area of the umbilicus 1 hour ago. On physical examination, what we see? Prick and cut painful wound of about 0.5 into 1 centimeter. Painful wound of about 0.5 into 1 centimeter around the umbilicus on the abdominal skin with the slight bleedings. So how would you help this patient? See, if any traumatic patients, if any trauma patients came to your clinics, so the first things you need to do the A, B, C, D, E. उसको क्या बैठ के पढ़ाना है? उसको ABCD पढ़ाना है, ठीक है? A, B, C, D, E. So first you need to check about the airway. The first you need to check about the airway in this patient. If the airway is good, then go for the breathings. Any trauma patients, if any trauma patient is there, see, if any trauma patient is there, any trauma patients, so in that trauma patient, you should having to do the primary assessment. You have to do the primary assessment. The primary assessments, you need to follow the A, B, C, D, E. The first you need to do the airways. The first you need to do the airways. Okay, let it do it here, because in this I will take you. There was one question about the Glasgow Coma Scales in the 2023. Okay, so let's do it here. So trauma patients, if any trauma patients, firstly we do the primary assessment. Firstly we do the primary assessment. In primary assessments we will do the A, B, C, D, E. In A we do the airway. We will check for the airway. The first things that we will check will the airway. B, then we will check if the person is breathing or the not. The C, we will check about the circulation. The circulations. You should know the name also. You should also know the name of these things. C, in FMG exam they ask you D for disability. What is the meaning of the D? So D for disability, and E for evaluation. E for exposure. Sorry, E for exposure. Okay, so A, B, C, D, E, you need to check it out. After that, once the primary assessment has been done, then you need to go for the secondary assessment. In the secondary assessment, what you will do, you will take out the history. You will take the history of these patients, and you will check the evaluations, head to toe evaluations. You will evaluate the persons from head to toe regions, and then you will do the special investigation if needed, and you will give the definitive treatment. But the first priority will be the airway. Once the airway has been done, then you need to go for breathing, then check out the circulations. All these things should be done very, very quickly, as early as possible. See, I'm just telling you these things verbally, because these are the, you can keep in your minds, like in the format of the story. See, whenever the airway comes, so always see, airway means the problem with there can be the nose blockage. So whatever the debris will be there, you need to clear that debris, or clear the जो कचरा बच रहा है सारा उसको clear करो, mud, dirt, clear everything. After that, if any foreign body is there, remove that foreign body. Try to remove that foreign body. If any fracture is there, stabilize the fractures so that airway will be the possibles. Okay, then you can do the endotracheal tube, you can give the laryngeal mask, airways, you can provide the mask, you can give the endotracheal tube, so the persons can having the take the oxygens initially. After that, you need to check about the whatever the dangerous things, like if anything, if the person there is a trauma in the mouth regions, then you need to go for the tracheostomy. You take the wide needles, and in the wide needles you will pierce the thoracic region, so that air can go inside. The main target, the air should go inside, oxygen should go inside in any circumstances. That we need to do firstly. Then after that, the breathing will be there. In the breathings, we will check if any pleural collection is there, pleural empyema is there. If anything, pneumothorax, hydrothorax, all these things we will take, and we will take the drain collections. We will collect those drains and will aspirate everything. Like if the case of the pneumothorax or the hydrothorax, second intercostal space and the sixth intercostal space, then we will contract, and along with that we will provide the ventilatory support also. Then there will be the circulation. In the circulation, the first things the patient will be the tachycardia. And also remember, this is a question, that tachycardia, it is the earliest sign of hypovolemia. It is the earliest sign of hypovolemia. It is the earliest sign of hypovolemia. Hypovolemia means blood, the fluid loss. So earliest sign of hypovolemia, the blood loss or the fluid loss from the body, is what? Tachycardia. The tachycardia. Along with that, we also see the cutaneous vasoconstriction also, but that is very for the little time, for very like for few seconds. So the cutaneous vasoconstriction is also seen. Cutaneous vasoconstrictions. Along with that, if the tachycardia, if more blood loss will be there, then hypotension. So you can see that these are the sign of the shock are coming. So hypotension is the late sign. Hypotension, once the lots of the fluids will be moved out, so that will become the late sign of hypovolemia. The late sign of hypovolemia. So we need to provide the IV fluids, the crystalloid IV fluids we will give. Here what we will do, crystalloid IV fluids will be given. We will provide the crystalloid IV fluids will be given. We will take the like the fluids, and then we will keep doing the things. Then disability. The disability, this is what tells us about the loss of consciousness. The loss of consciousness. Loss of consciousness is determined by the Glasgow Coma Scales. So there was no question in the Crook 2 exam before about the Glasgow Coma Scale, but in online exams they gave the one question, because one question was there in the test center website. The one question was there in the test center website. That's why they modified that question and they gave that question in the online exams. So in the one paper it will come, then it keep continuously coming about the Glasgow Coma Scale. And this Glasgow Coma Scale is not important just for the Crook exams. It's important for all the exams. It's important for all the exams. Okay, so let's do it. Okay, as we have seen, the our question was about the hypovolemia, because there was the blood loss. So so if we having, what we need to do in these conditions, firstly we will give the crystalloids IV fluids. Firstly we will give the crystalloids IV fluids. Then we will monitor the urine outputs. We will monitor the first things what we will do, we will monitor the urine output, because with the urine output we can monitor the patients, and with the help of that, like if the urine output is more than 0.5 ml per kg per hours in the adults, we can say that this is the minimum urine output this patient should having. If it is less than that, it means that this patient will be having more loss of the bloods. Then if more than 30%, if more than 30% blood loss is there, so in that conditions what we will give, we will provide the blood transfusions. The blood transfusion is needed. But still, if you not able to maintain by anyhow, you gave the crystalloid IV fluids, you monitor the urine output, but you also do the blood transfusion at very high rate. You provide the O negative blood groups, because O negative blood group, that is can be given universal donor. So that is, you provide everything and you did everything whatever the possibles to stop the bleedings. There was an injection also, the tranexamic acid. So this is to stop the bleedings. to stop the bleeding. But still the bleeding is continuously going, continuously bleeding is occurring, continuously bleeding is occurring. So in that cases, you don't need to waste your times. What you will do the laparotomy. Laparotomy. You will cut the abdomen. कट ऐसे नहीं करना है कि एकदम चाक तलवार लो और उसको पेट को एकदम से काट दो, ऐसा नहीं. You will make the incisions. Laparotomy, you will make the incisions. Then what you will do? You will go inside. अपने हाथों के थ्रू या अपने जो इंस्ट्रूमेंट है उनके थ्रू. Then you will check wherever the bleeding is there. कुछ भी ना मिले, take the some gauze, take your hand and then put your hand in that that injury, and so that the bleeding can be stopped. Okay, what you will do? Laparotomy, and after that what you will do? The immediate surgical explorations. एक्सप्लोर करो अंदर जाके कि कहाँ पे फटा हुआ है, कहाँ पे पाइप फट रही है. तो उस पाइप को जाके जल्दी से जल्दी उस पे धक्का मारो, और धक्का मार के क्या करो? उसको एकदम से अपने हाथ से या किसी से भी या फिर कोई गोज वगैरह है तो उसको एकदम से उसको सील कर दो. वैसे once you do the laparotomy, do the immediate surgical explorations, and once the immediate surgical exploration you find that the bleeding is going from here, the bleeding is in this blood vessels, this blood vessels is completely ruptured. What you need to take your hand or take your any gauze, whatever you have, and put the pressure in that blood vessel so that bleeding can be stopped. So this is the result, the laparotomy, immediate surgical explorations, and control bleedings manually. Control bleedings manually. Okay, so this is that is how you can control the hypovolemia. So disability, the loss of consciousness, monitor the urine output. If more than 30% blood transfusion, tranexamic acid to control the bloods. Tranexamic acid is given in the 2 dose. So first dose is given within the 10 minutes and the second dose is given after the 8 hours. The first dose within the 10 minutes and the second dose repeated within the 8 hours. Then after that still the bleeding is continuing, so then you will do the laparotomy, and after the laparotomy you done, you do the immediate surgical explorations, and in your exploration you will see what you will check the blood vessels. Whichever the blood vessels is ruptured, manually you will put the pressure on that blood vessels. That's how you would be able to control the bleedings. So that is what disability. That is what the treatment for the bleeding or the hypovolemia conditions. Then disability, the disability is the loss of consciousness. The disability is the loss of consciousness. Okay, manually you will need to put the direct pressure. Direct pressures will be put. Then disability, we have to see the loss of consciousness. The disability, what you will see? The loss of consciousness. In the loss of consciousness, what you will see? You see that there is a Glasgow Coma Scale. So let's discuss what is the Glasgow Coma Scale, because that is the important one. Glasgow Coma Scale. So see, एक बार पढ़ लेना, एक बार में समझ में आ गया तो आ जाएगा, दोबारा बार बार में समझ में नहीं आएगा. If you will study it first times, you will be able to recall it every time, but if you will not focus now, you will be never focused. ठीक है? So let it be focused. इधर आ जा, इधर आ. Glasgow Coma Scale. Glasgow Coma Scales, there are the maximum, there are 15 scores, and include the eye, verbal and motor. It includes the eye, verbal and motor. So what is that? EVM. Did you hear about the EVM machine? So EVM machine is what? That is Glasgow Coma Scale. For the eye, remember the maximum that is for the eye is the 4. Verbal, the point for verbal is 5 and motor is 6. So EVM 4 5 6, EVM 4 5 6, EVM 4 5 6, EVM 4 5 6. Repeat with me. EVM 4 5 6, EVM 4 5 6. Minimum will be always 1 for the eye, 1 for the verbals, 1 for the motors. So maximum will be the 15 score and minimum score will be 3. The minimum score will be 3. We can consider it into the mild. Mild consciousness, when it will be the mild consciousness, 13 to 15. It can be the moderate, it can be the moderate, and moderate will be चलती क्या 9 से 12, चलती क्या 9 से 12. So from 9 to 12, from 9 to 12, that is the moderate. Then severe conditions, what you will see, less than 8, less than equal to 8 will be the severe conditions. So mild, moderate and severe conditions. If dad will get the 3, dad will be the 3. So mild will be, so remember moderate, moderate मतलब चलती क्या 9 से 12. Let's go from 9 to 12. So our class will be from 9 to 12. ठीक है, like this according to my time. ठीक है, it will be 9 to 12. So remember this time. Then mild will be 13 to 15, severe will be less than 8. Okay, is that clear? Now see, if we talk about the eye, थोड़ा सा लिटिल बिट अभी हार्ड लग रहा है, बट बाद में करने में मजा आएगा इसको. ठीक है, देखो, इफ वी टॉक अबाउट द आई, इफ आई से हु इज स्लीपिंग, कोई तो सो रहा है तुम में से. ओके, इफ आई से दैट, किसका नाम लो, सुलभ. ओके, इफ आई एम से सुलभ वेक अप, तो सुलभ एकदम से अचानक से उठेगा. ठीक है, तो दैट विल बी कॉल्ड स्पॉन्टेनियसली, दैट विल बी द स्पॉन्टेनियसली, spontaneously, and the spontaneously will be 4. What the marks will give the spontaneously? If active person is there and the spontaneously will be, so spontaneously he will wake, he will open his eyes, he will open his eyes, so mean that is the spontaneously. If by voice or by sound, if I'm speaking a lot, if I'm speaking very loudly, and then I'm saying Sulabh, then he then he open his eyes, so that means the 3 will give the 3 numbers. Then he did not open his eyes, and then what I did, I press his eyes and I press his body tightly, then he is open his eye by pressing, then it will be the 2. Then he did not open his eye, so that is a 1, that is a 1. Okay, so 4, 3, 2, 1. Then after that there will be the verbal, there will be the verbal, the verbal will be there, the consciousness, the verbal will be there, that is the conscious or oriented, the conscious or oriented. If I am saying, if some of you are what, they are very conscious or very oriented, very concentratedly focusing on this lecture, but some are not, so I will give them 5. So if any consciousness, or if you are concentrated, if you are orientated, means what, I will give the 5. Verbal, when what I am speaking, you are hearing that sounds and you are understanding at that particular time, that is conscious or oriented. What score I will give you? 5. Okay, but I am teaching you and still you are confused, still you are confused. ठीक है, तो कंफ्यूज की करना क्या है, ये कहना क्या चाहते हैं, वर्बल होता क्या है, आंखें क्या होती हैं, हमें क्या पता, हमारे थोड़ी ना आंखें हैं. So that is verbal. Confused, you are confused, so I will give you the 4 marks. Okay, then you are saying the words or the inappropriate words. पता नहीं यार क्या करा रहा है, समझ में ही ना आ रही क्या हो रहा है क्या नहीं हो रहा है, पता नहीं कभी आई सुना रहा है कभी वर्बल बोल रहा है. So that is the inappropriate words, so I will give you the 3 marks. Okay, in English, whatever, like if you are saying this type of the like burbling sounds is there, so it means that is the inappropriate, or any inappropriate words is there. Don't touch me, I don't know what are you teaching, I don't know anything, he will like murmuring, कुछ गाली दे रहा है या कुछ भी कर रहा है. So that is the words, and I will give him the 3 points. If he is producing the sound, like I say Sulabh, like he producing just a sound, not able to speak any words, so I will give him the 2. This is the person that is under the trauma, he is under the severe trauma. So based on that, if the person is consciousness, person is not conscious, so based on that we will classify the verbal score. Okay, and if the none, if he not producing any sounds, that means we will producing the 1. Okay, I am repeating it again. I, if spontaneously is producing the, spontaneously अपने आप से वो अगर अपनी आंखें खोल रहा है तो that is the 4 sounds. In Hindi I am speaking. See, अगर अपने आप से आंखें खोल रहा है तो उसको 4 नंबर, अगर किसी आवाज सुन के या कोई साउंड सुन के वो अगर आवाज खोल रहा है तो उसको 3 नंबर, बाय अगर किसी को उसकी बॉडी को प्रेस करके वो आवाज अपनी आंखें खोल रहा है तो 2 नंबर, अगर वो अपनी आंखें नहीं खोल रहा है तो 1 नंबर। वर्बल में क्या होगा कि अगर वो कॉन्शियस है और ओरिएंटेड है, ठीक है, फॉर एग्जांपल कि जैसे जिस तरफ से आवाज आ रही है उसी की तरफ वो ओरिएंट हो जा रहा है, किस तरफ से आवाज आ रही है तो उस तरफ मुंह घुमाया और उसने मतलब बोला, अच्छे से वो क्लियरली बोल पा रहा है तो उसको हम देंगे 5 नंबर। कंफ्यूज्ड है कि क्या बोलना है, जैसे फॉर एग्जांपल कभी किसी को एकदम से एक्सीडेंट हो जाता है और एक्सीडेंट होके वो सोचते हैं मैं कहाँ आ गया, क्या हुआ मेरे साथ, क्या हुआ, क्या होना था, मैं यहाँ पे क्यों हूँ, सो दैट इज कंफ्यूज। वर्ड्स इनअप्रोप्रिएट वर्ड्स, ठीक है, वो डॉक्टर को ही कुछ ना कुछ उल्टा बोल रहा है, अबे तू कौन है, तू मेरे को लेके आया, तूने मेरे को एक्सीडेंट कराया, तूने मेरे को कुछ कराया, सो दैट इज द वर्ड 3 इनअप्रोप्रिएट वर्ड। साउंड मतलब कुछ भी, मतलब समथिंग इज बरबर कर रहा है, ठीक है, सो दैट इज द साउंड, ठीक है, कुछ वर्ड्स नहीं बोल रहा बट एक साउंड हो रहा है, हाँ, some sounds are producing means 2 is there, is in the severe conditions, ठीक है, none means not able to speak any words or any sound also, that is the none. Okay, I will repeat it again in English also. Then motor, see, motor is what, if he obeys your command, motor means like something motor. If I am saying to you that you should do this homework, okay, and next day you are completing your homework, so it means you are obeying my commands, you are obeying my commands, so that is what the I will give you the 6 marks, I will give you 6 marks. The localize, okay, in this person, the traumatic persons, if he is obeying the like, for example if I am saying touch your fingers in your cheeks, so he is touching the fingers in his cheeks, okay, so that is he is obeying my commands. Localize, if he is localizing the motor symptom, motor functions, means if the person is localized only in the one region, so that is the localized symptoms. If I am saying to the normal flexion, he is able to do the normal flexion, so that will be the 4. If normal extension is there, if he is able to do, sorry, if before that, if abnormal flexion is there, abnormal flexion is there, so abnormal flexion means 3 score. Then extension, if he is able to do the extensions, means 2, and none is 1. Okay, so he able to do the normal flexions after giving the command. We are giving the command, if he obey the command, 6 number. If he localize the commands where it is localized, so it is the 5 score. If normal flexion 4 score, abnormal flexion 3 score, extensions 2. They will not give you the direct question, they will give you in the question, so you need to take out the check out the or calculate the score of these conditions, and then based on that you will able to know which how much score this person have and how much consciousness is this person having. Okay, is that clear? Anyone have any doubt? किसी को कोई डाउट है तो बता दो. Anyone have any doubt? Okay, so let's come back. So I hope this is clear. The I spontaneously by the voice sound by pressing or the none. Verbal, conscious, oriented, confused, words inappropriate, sounds or nones, motor, obey, localize, normal flexion, abnormal flexion, extension or the none. And also remember these things, if mild 13 to 15, moderate no say 12, 9 to 12, severe less than 8, dad is equals to 3. Okay, after that there was a exposure. After that E means exposure. The E means exposure. In exposure, what we have to do, we need to check if the person is not under the hypothermia, because the heat lost from his body, so the person should not go to the hyperthermia. Undress, taking care of hypothermia. So that is the exposure. That is the exposure. Means we should not give the any cold things to these persons, like no cold IV fluids or the any cold bloods can be given. They should be all avoided. Any cold substances should be avoided in this person. ठीक है. Then there is a one triage also. There is a one triage also. In the triage also, remember, we having the three category: the red, yellow, green. What are these? Traffic light, red, traffic light, red, the red, yellow, and green. Okay. So this you need to remember, the red, yellow, and the green. So this is the traffic light signals. With the help of that red, yellow, green, the red, the persons or the patient who need immediate interventions, immediate intervention. Yellow version will be those who need early intervention required within the 6 hours. Green means the person is what? Ambulatory patients. This is the ambulatory patients. These persons can wait. There is a one more triage that is not in the triage also. Some include it in the triage, some not. So that is the black. Black means black. Life में कालापन. So that is the pulseless or the death. You can remember the black or the death. Okay. See, now study. Red means that person is like in the severe conditions and need immediate treatment. Okay, this person cannot survive if you will not provide the immediate treatment. Yellow, they have the time, at least minimum 6 hours they can wait. So for that, in that conditions, we will prefer the yellow to wait at least 6 hours. The first priority will be the red, the second priority will be the yellow, the green will be the ambulatory patients. Green patients in India वो होते हैं जो कि वेट करते हैं. जैसे फॉर एग्जांपल किसी का एक्सीडेंट हुआ, ठीक है, तो वो भी आएंगे कि पता नहीं मेरे को भी क्या हो गया है, मेरे को भी ऐसा लग रहा है कि मेरे अंदर से कुछ ना कुछ ब्लीडिंग क्लॉट हुआ है. तो वो दे आर द एम्बुलेटरी पेशेंट जो मनगढ़ंत कहानियां बनते हैं. दैट आर द अनएम्बुलेटरी पेशेंट्स who makes the ambulatory patient who makes the false stories that I can also having some injury, so please check me first. Okay, so that is the ambulatory patient. And triage means we are segregating the patients based on the consciousness or based on the category of the patients, like if which patient need the early intervention, which patient need the late intervention. So the red, immediate, yellow, or the green. Okay. In secondary survey, I told you that in the secondary survey we will take the history, head to toe evaluations, and we will take the detailed history, in which we check about the allergy, we will check about the medication history. The medical history, like for example, if the person is taking to prevent the clotting. Okay, so for that we need to change the like aspirin. If the person is taking the aspirin, we know that is the anti-platelet drugs. So for that we will stop the aspirin. Along with that, we will give the any platelet drugs. Okay, then we can get having the we will check about the past meal, we will check about the last meal, events of injury, and then head to toe evaluations. We will do the special investigation, X-ray, CT scan, MRI, and then we will provide the definitive treatment to that patients. Okay, So this Glasgow Coma Scale is important, and this that I told you, this one is again important. Okay, so monitor the urine outputs, then you will do the blood loss, blood transfusions, then tranexamic acids and laparotomy, immediate surgical explorations, and this was our questions. See, now patient has come to the clinical wounded, so they have the wound, and so that what you will do on physical, there prick and cut painful wounds about 0.5 around the umbilicus on the abdominal skin with the slight bleeding. So how would you help them? We will check the, this is the best options, the laparotomy. Then we will check about the abdominal cavity organ inspection, from where the bleeding has been occurring, and then we will do the primary surgical processing of the wound. Okay. Then the next question, if a child has adherent fingers on the right hands, so what you are seeing, the adherent fingers, we call this as the adherent fingers. What will be your diagnosis? So what we call this condition? We call this condition as the syndactyly. The syndactyly, that means adherent fingers. Electrodactyly means this is the split hand. Electrodactyly means split hand. They will not ask you this. The split hand, they will not ask you. The split hand, or the you will see the cleft hand, cleft clip or cleft lip we studied. So this is what the split hands. Like if I will share the image, इतना अच्छा diagram नहीं है मेरे पास, ठीक है, like this one. Then we can having like this. If we have seen that these are the adherent fingers, the adherent fingers will be there. And in case of the electrodactyly, you will see there is a one cleft hairs, so that will be the electrodactyly. Electromelia means if the long bones are missing, underdeveloped or underdeveloped bones, Polydactyly means more than Hrithik Roshan's, multiple fingers. They have the more thumbs, but he having polydactyly means multiple fingers more than equal to 5. Macro means big, so big finger will be there. Okay, the questions will be from here only. A 34-year-old patient was bitten by a dog 3 years ago. There was a wound by a dog teeth without bleeding in the left arms. So कोई भी, if any rabies things is there or dog bite conditions, the dog bite condition, the first priority will be there, or the first profile axis. सबसे पहले रोकथाम हम क्या करते हैं, जितना ज़्यादा हो सके उसको हम क्या करते हैं, वाटर से या सोप से क्या करते हैं, उसको अच्छे से क्लीन करते हैं. What we do, we will clean the wound maximally with the detergent water and will apply the some soap like antiseptic soaps. So all these things will be applied. Okay. See, rabies are there. Rabies. The rabies is what? This is the bullet-shaped virus. It is the bullet-shaped virus. It is the bullet-shaped virus. Then it is having the lipid envelopes. It also having the glycoprotein spikes. Then other things that you need to remember about the rabies, that how it will be transmitted, the mode of infections. So that will be the bite of rabbit, dog, and rabbit. It's rabbit. Okay, rabbit, dog, and other animals. The most common is what? The bite of dogs. The most common is the bite of dogs. So what happen in these conditions? they will ask you, they can ask you about the incubation period also. If the incubation period we talk, the incubation period, remember, this will be 1 to 2 months. The incubation period will be 1 to 2 months up to 1 year. Up to 1 year. That will be the incubation periods. Early symptoms, the clinical features, the early symptoms, or what we will see, the early symptoms we see that they will see the paresthesia, the malaise means problem with the muscles, nausea, vomiting with fever. So all these we will be seen. Then in case of we having they involves the acute conditions also, and in acute conditions they involve the neurological conditions also, and the neurological conditions what we can see they are having the seizures, they can be having the seizures, hallucinations, we can see the hallucinations, we can see the hydrophobia, ये वाले हाँ, in options, in questions you will get hydrophobia or aerophobia, hydrophobia, aerophobia, okay, all these signs you will see in neurological conditions. Along with that, there you can see the salivations, okay, priapism means painful erection, and pupil dilatation also. The autonomic functions you will see, the autonomic the functions, pupil dilatation. Then after that there will be the paralysis also can be there. Paralysis, we call it the paralytic rabies. The paralysis, remember, they will give you in the question itself ascending flaccid paralysis. Ascending flaccid paralysis. So this is seen in case of the rabies. There can be the coma, and that is followed by death. The coma followed by death will be seen. Along with that, can you tell me what are the pathognomic inclusion body? Pathognomic inclusion body. Pathognomic inclusion bodies that we seen in rabies. Can you tell me the pathognomic inclusion body's name? One person is confused, will the able to obey you? Why he will obey me? If person is confused, see, there are the two things. The person is confused, that is the verbal things, and if he obey the commands, so that is the motor things. Okay, in the motor we are giving the command to the patients, and after that we are checking verbally. We are checking the verbal of that patients. If he is speaking, then we will give the 5. Then if he is having some confusion, like he is not able to speak properly and he is some confused, so that why then in that conditions we will give the 4. Bablu Singh Lodhi, that is the Negri, that is the correct answer. So we have the pathognomic, that is the correct answer. Who left the meeting? The 2 persons left the meetings. Okay, just a second. I can make your attendance. Kalagi Patel, Swami. इधर पानी वानी पी लो तुम 2 मिनट. Take water. क्योंकि बाद में सारे मेरे को ही बोलेंगे ना कि भाई पढ़ाया नहीं, समझ में नहीं आया, वो नहीं आया. Please show the note of 16 and 17. Okay. (16). If the split hand is there, then cleft. The split hand will be there electrodactyly. Electromelia, multiple fingers, macrodactyly. Clean wounds, rabies, bullet-shaped virus. Mode of infections, the bite of the rabbit or dogs or other animals. Most common is the bite of the dogs. Incubation periods 1 to 2 months. Clinical features early paresthesia, malaise, nausea, vomiting with fever. Acute neurological seizures, hallucination, hydrophobia, aerophobia, salivation, priapism, pupil dilatations, paralysis, ascending flaccid paralysis, coma followed by the death, and pathognomic inclusions bodies we see, that is the Negri bodies. That is the Negri bodies. Okay. Then they will ask you about the post-exposure prophylaxis. If the it is bitten by the dog, so what is the post-exposure prophylaxis? See, the post-exposure prophylaxis, the first things that you need to wound toilet. The wound toilet. You need to clean the wounds. The wound toilet means clean the wounds. So you need to give the maximum amount of water and soap. The maximum amount of water and soap will be applied to these conditions. Then washed for 15 minutes. Washed for at least minimum 15 minutes should be there. Okay, and then topical iodine will be applied. The topical iodine will be applied. Okay, and after that what we will do? We will do the rabies immunoglobulins. What we will do? We will do the rabies immunoglobulins. Rabies immunoglobulins includes like the human rabies immunoglobulins, or it included from the equine. Equine means horse. Horse rabies equine rabies immunoglobulins. Okay. That you need to understand. So this is the easiest question. So if it is bitten by dogs, means there is a chances of the rabies. So that's why we will clean the wound with the detergent water and apply the antiseptic. Then after that, purulent mediastinitis is diagnosed at the 63-year-old patient. What disease from the stated below cannot cause the purulent mediastinitis? See, if we talk about this condition, this is integrated with the anatomy. Actually, this is the question from the anatomy, not from the surgery, in which we should having the knowledge of the mediastinum. What is the mediastinum? What is the content? What is its content? Okay, let's do it here. Mediastinums. So mediastinums, if we say that it is the mobile septum between the two pleural sacs. Between the two pleural sacs, if we see there is a septum that divide the mediastinum into the one, there is a superior mediastinums, and another one is the inferior mediastinums. That is the superior, or another one is the inferior mediastinums. Okay. So in these conditions, you should having the knowledge of the mediastinums. As I can't go so much in the details because it will take too much time. So I'm telling you the verbally some things. If we talk about the boundaries for the superior mediastinums, so superiorly if we see, Superiorly it will be lined with the thoracic inlet. Superior mediastinum superiorly by there will be the thoracic inlet. Inferiorly, what we see, there will be some imaginary line from the sternal angle to the T4. There will be the imaginary line from sternal angle to T4. Anteriorly, what we see? What we see is the sternum. The anterior side, what we see? The sternum. And posteriorly, what we see is the T1 to T4. The posteriorly we see the T1 to T4. Okay. So this is what including the superior mediastinum. Inferior mediastinums include the inferior mediastinums, pericardium and heart. And again this inferior mediastinum, it is divided into the anterior, middle, and the middle mediastinum, what we see? Pericardium and the heart. Okay, just listen me, don't write these things. Then posterior mediastinums. Okay. If you talk about the content of these superior mediastinums, so it include the thymus glands. Also present in the superior mediastinums. Okay, and this superior thymus gland, it extend till the anterior mediastinums. Along with that, we see the right and left brachiocephalic veins. Just keep remember this in mind. Superior mediastinum will include the thymus gland, right and left brachiocephalic vein. After the right and the left brachiocephalic vein, there can be the arc of aorta also. The arc of aorta can also be seen, and its branches also can be seen. Left common carotid artery can also be seen. Okay, then after that there can be the phrenic or the vagus nerves can be seen. The phrenic and vagus nerves can also be seen, and there can be the left recurrent laryngeal nerves. Don't write this, I will share you the one image, so in that image everything will be clear. Okay, then there will be the trachea, or there can be the esophagus. Okay, so can you remember these things? Can you just remember these things? Superior mediastinums contain the thymus gland. Superior mediastinums contain the right and the left brachiocephalic veins. Superior mediastinums contain the trachea, and superior mediastinums contain the esophagus, and also they contain the thoracic duct as well. So you need to remember the 5 things in the superior mediastinums, or other things I also told you, just read it and forget it. Okay, because once you read it, it will be in your subconscious mind for long time. Then if we talk about the inferior mediastinums, as I say that the thymus glands will be extended till the anterior mediastinum, so it includes the thymus. Then after the thymus, it includes the internal thoracic artery also. It includes the pericardium and the heart also. Ascending aorta will be there, pulmonary trunks will be there, phrenic nerves will be there, because whatever the things is coming down will be there. Along with that, there will be the vagus nerves. Esophagus is also long, that is completely present, so esophagus will also be here in the posterior mediastinums. So along with that, the azygous vein will also be present. Okay, so I told you, you need to remember just these things, that in case of the mediastinum, not superior, inferior now, thymus gland, right, left brachiocephalic one, the trachea, esophagus, the thymus, pericardium and the heart, and azygous vein. all these present in case of the in mediastinum. They are the content of the mediastinums. Now tell me, each did I take the name of the cervical? No, I didn't take, because this is not a part of the mediastinums, and that is what we need to answer. Purulent mediastinitis is diagnosed at 63. What disease from the stated below cannot cause the purulent mediastinitis? So see, deep neck phlegmons, yes, it can cause because it is present in the neck, and thoracic inlet will be there. The perforation of the thoracic part of esophagus, iatrogenic injury of the trachea, perforation of the cervical part of the esophagus. So all these cannot be the answer, because they are all are the part of media. They all can cause the mediastinum because they all are the part of mediastinum. But the cervical lymph node is not a part of the mediastinums. That's why it will cannot cause the purulent mediastinitis. It is the inflammation of the cervical lymph node. Is that clear? ये वाला क्लियर हुआ? Okay. Please, if possible, show from the today class start, please too. Okay, we'll show you. See, if you don't able to understand anything in the class, okay, and you are shy people and you don't want to engage in the class, you don't want to disturb me in between the class, because you are like, you are so good persons, and you don't want to distract me in between the class. So that's why I gave you the my WhatsApp number, and my WhatsApp number is 9671779815. Okay, these are my WhatsApp number. There is a one chat, so you can just after the class you make me, you send me this notice. Okay, sir, I did not, bhaiya, I did not understand this one, so I will share the recording at that time only. Don't, if you will say me after the 2 days, it will take the time, but if you say me just after the class, it will be, I will just share just after the class only. Okay, so it will be beneficial for you. So if you don't understand anything, just don't be shy. If you will shy, your marks will be reduced. ठीक है, यहाँ तक समझ में आ गया? So this is what the mediastinums. The mediastinums, I told you, this is the, like the, we can see the mobile septums or the mediastinum. This you can say the thoracic part. The thoracic part is what mediastinums. And if you want to know the definition, that is the like the mobile septum between the two pleural space, that is the mediastinums. And in simple words, you can understand this is the part of the thoracic, where everything is including the thorax, esophagus, arc of aorta, everything is present. This is the question, the same question. Then a 36-year-old patient was diagnosed with the right-sided pneumothorax. What method of the treatment is indicated to the patient? So surgical treatment, drainage of the pleural cavity. The pleural punctures we will not do because this is the better options. Why this is the better options? Because in the pneumothorax we discussed that there is a second intercostal space, and in the second intercostal space, firstly we try to do the drainage, then we will do the pleural puncture. We will not to do the pleural puncture. They involve the surgical treatment. So if you are getting the surgical option, so that means, because in the question itself you also see that they describe it is in the operation, the surgery, so that's why it will be the better option in this question. Okay, I think this is the same questions. Yeah, same question. Then question number 22. A 16-year-old patient, we can see that there is a 16-year-old patient with the complaints of frequent pain in the abdomen was diagnosed with the melanoma. Examination reveals also pigmentation of the mucosa in the skin, and we can see that there is a polyp in the stomach and large intestines. It is known that the patient's mother has the analogous pigmentations that is often treated for the anemia. So what disease is suspected? Okay, so see, if we talk about the firstly this is the wrong spelling. It is the Peutz. It is the Peutz-Jeghers syndromes. Peutz-Jeghers syndromes. Okay, so Peutz-Jeghers syndromes, it is the autosomal dominant conditions. Peutz-Jeghers syndrome, it is the autosomal dominant conditions. Peutz-Jeghers syndromes. It is the autosomal dominant conditions. So autosomal dominant condition, and also remember there which gene will be defected? STK11 gene will be defected. STK11 gene. What is the STK11 gene? Suppressor serine. It is the tumor suppressor genes, that is the serine threonine kinase. Serine threonine kinase 11 gene will be there. What are the clinical features we will see in this condition? We see there is a hyperpigmentation. There will be the hyperpigmentations will be seen. And hyperpigmentation where we will see? On the buccal mucosa, on the lips and digits. So here we will see the hyperpigmentation. Along with that we see there is a hamartomatous polyp. हमारा पोलिप किस में मिलता है? hamartomatous polyp किस में मिलता है? Peutz-Jeghers syndrome में. किस में मिलता है? Peutz-Jeghers syndrome में polyp where it is present? In intestinal tracts. In intestinal tract it will be present. Okay, then it will be in case of the Peutz-Jeghers syndrome, what we will see? There is an increased risk for the cancer as well. Increased risk. I will share you. I will show you the notes. Don't worry. Then there will be the increased risk for the cancer. There will be the increased risk of the cancer of intestinal tract. I will repeat that GCS topic again. The increased risk for the cancer of the intestinal tract also. Then there can be also the increased risk of extraintestinal, because this can be the malignant conditions, and that can involve the other organs like the breast, ovary, it can involve the cervix, fallopian tube, thyroid, lungs, gallbladder, any other organs can be possible. Then after that we will do the if you want to do the screening, so screening will be done with the help of the as it involving the intestine, so that we will do the colonoscopy. And for upper like upper parts we will do the upper endoscopy. The colonoscopy and upper endoscopy will be done. Okay, so that you need to remember. So now see the question. There is a frequent pain in the abdomen, was diagnosed with the melanoma. Melanoma because there is a hyperpigmentation that can cause the tumor. Also pigmentation of the mucosa and the skips, polyps in the hamartomatous polyp in the stomach and the large intestine. There see we can see have the polyp in the stomach as well in the large intestine. That's why we do the screening of the both. We do the colonoscopy also because it's involved the large intestine. Along with that we do the upper endoscopy also. The colonoscopy also. We will do the colonoscopy also. Colonoscopy. So we will do the colonoscopy also and upper endoscopy because it involving the stomach also. It is known that the patient mother has analogous pigmentation and is often treated for the anemia. So what disease is expected? So along with the pigmentations, the polyps, what is the answer? That is the Peutz-Jeghers syndrome. Crohn's disease we already studied. Adolescents polyposis not required. Then Hirschsprung disease we will study. and tuberculosis of the intestines not required. Okay, is that clear? Peutz-Jeghers syndromes. So this is what that you need to remember. Now let's see the GCS. See, this is the Glasgow Coma Scales. I'm repeating it again. Glasgow Coma Scales, remember the EVMs. EVM, eye verbal motor. EVM, eye verbal motor. EVM, eye verbal motor. Repeat with me. Glasgow Coma Scale, GCS scales, is used for the consciousness of the patient. Used for the consciousness of the patient. E for eye, V for verbal, M for motor. EVM, eye verbal motor. EVM, eye verbal motor. 4 5 6 4 5 6 4 5 6 4 5 6 4 5 6. Moderate 9 to 12. Moderate 9 to 12. Moderate 9 to 12. After that, I see. I will be the spontaneously. The spontaneously 4. Spontaneously the I open spontaneously 4 points, 4 scores. I open with this help of the sound or with any sound. So 3 score. If I will be open just by the pressing, if you pressing the body, then I will be open. So we will give the 2 scores. If I will not be open, none. Verbal. If the person is conscious and oriented, person is speaking well, person is consciously speaking, person is oriented verbally, so that we will give the 5 score. If the patient is confused that what to speak, what not to speak, that is given the 4. Words inappropriate words is telling. If the person is telling some inappropriate words that is not understandable, so that we will give the 3 scores. If the person is just producing the sound, not any words, then we will give the 2 score. If the none is there, the 1 score. If the motor functions, we will check about the motor function. If he obeys the command, then means 6 score. If it localize the pain, okay, for example pain, if we localize the pain, then we will give the 5 score. If the normal flexion is doing, then means 4 score. If abnormal flexion is doing, then we will give the 3 scores. If extension will be there, then the 2, and the none will be 1. Okay, is that clear? And the triage is what? This is a segregation of the patient based on the consciousness and consciousness, red, yellow, green, black, immediate, early, ambulatory, and the death. Okay, is that clear? I hope that is clear, and this is done, urgent, done. Now question number 43, ये भी कर लो. A 41-year-old patient was admitted to the intensive care unit, ICU के अंदर उसको admit किया गया with the hemorrhagic shock due to gastric bleedings. Hemorrhagic shock is there due to gastric bleeding. He has a history of hepatitis B. History of hepatitis B during the last 5 years. Why I highlight this? Then the source of bleeding are the esophageal vein. The source of bleedings they given, that is esophageal vein. So what is the most effective method of control of bleedings? So what we will do, we will put the obturated nasogastric tubes, and with the help of that, with the nasogastric tubes, we will be able to control the bleeding from the esophageal veins. Okay, so that is the direct answer. Then question number 24, because it's involved the big topics, we will do for tomorrow. Okay, is that clear everyone? Did you understand everything what we studied today? If you not understand anything, let me know, otherwise you can go. Okay, everything clear? Mani Dheeraj was not here.